So thanks everyone. So just two very quick slides that describe how other communities are thinking about diets and community-wide food demand. And we'll do this in every session. So on every topic, we'll look at how other places are doing it. And this is just a highlight with a few examples. So several cities have made broad goal statements. And so here's an example saying eliminate hunger. Or the other one saying from Portland, promote individual and community health by encouraging healthy food choices. So they're very general, big goal statements. It might even be like one of our principles. The second is more specific. So Denver has a specific target of saying 75% of youth and adults eat at least one serving of fruit. It gets a bit more specific. And then New York City and Philadelphia are doing specific actions. And so they're saying Philadelphia is thinking about a sugar tax. New York City has these beautiful green carts that are selling fresh fruits and vegetables in low-income areas. They're just lovely photos, and lots of people have access to fresh fruits and veggies through that. And then you'll notice very few people have actually done, you'll see that the same person isn't there, the same city isn't there across the spectrum. So a few cities have done outcomes assessment. So Portland has looked at tracking adult diabetes rates. Bristol, UK is looking at whether it can reverse childhood obesity rates. But there isn't a common thread saying here's a statement, here's a target, here's an action, and now we can do an outcome. And so that's something I think we'd like to do, or that's something for discussion as we think about our actions. Can we actually thread the pearls on the necklace and make the connections between the big goal versus a specific target, specific actions, and outcomes assessment. So that's the first slide. And the second slide, thanks Dana, is something we had proposed as an action, is to really look at the Milan Food Pact. So the Milan Food Pact was developed internationally. And it has some metrics, proposed metrics for cities to track. It hasn't actually been implemented with this sort of depth in any city in the US, so we would be one of the first cities saying, how does this track? What sort of outcomes, what sort of goals, targets, actions, and assessments would we do? And so what we did is we pulled out the Milan, so remember that our topics align with the Milan topics fairly well. So we said, what are the targets that the Milan Food Pact has pulled out? And do we have these baseline numbers for Minneapolis? And I'll just read these out because I'm not sure how well you can see this from the back. So the first indicator is minimum dietary diversity for women of reproductive age. And where do we know this for Minneapolis? This is why we have all the experts from health partners and public health. And so then the second one is the number of households living in food deserts, and we do know this. But we added another potential metric, which is the number of population that's in hunger, because that seems to be also important. I have just a few seconds left.
No, you're fine.
Oh, I see. And then we have the cost of a nutritious food basket is what the Milan had proposed, but it seems like we should look at the burden. What burden does that place on people's income, like we do for energy burden or travel burden? So this might be a metric. The third is average per capita daily consumption of meat. So they're looking for reaching a minimum, and we're saying we may be over-consuming. And so we'd have to really think about these metrics in terms of overconsumption. And so the recommendation is to limit this to 3 to 4 servings per week. So we might start to think of metrics in that sense. Number of adults with type 2 diabetes. This is an open discussion. Do we want to propose additional improvements to make it really relevant to the city? We have prevalence of overweight or obesity among adults, youth, and children. We have number of city-led support activities to promote sustainable diets. And Tamara and I were discussing this. This is so vague. What is a city-led activity to promote sustainable diets, and so we need to think through that. But the bigger thing you'll see in our presentation is that sustainable diets are not well defined. And so how are we going to count activities? Existence of policies that address sugar, salt, and fat. So this is something we might think about. You saw Philadelphia having a sugar tax. Presence of programs and policies that promote the availability of nutritious and diversified foods. This is something we discuss. One of the takeaways from our presentation today is it's not just access. Availability is not enough. It's also, do you know what to do with the food? So are there healthy cooking programs? So we may want to take this even further than what we have right now. And the last doesn't really apply, thankfully, to many of our cities. The percentage of the population with access to safe drinking water and adequate sanitation. This is coming from the UN Sustainable Development Goals, where in many other countries you would have 40–50% of the population just without a tap. So I'm just trying to give context. We're not in that place, but we may still want to talk about what safe drinking water means. Okay. So that's really the overview. We'll just keep going. We'll park these two top, this Milan Food Pact. We'll print it out like this next week so that people can add other things they think could be added to that list after we have all our discussions today. Does that make sense? Because I think that's also an evolving conversation. How do we use the Milan Food Pact? How do we improve upon it? So each topic, we'll bring it up. We'll give you a snapshot of what it is, where we are thinking it could be improved, but we'll open it up next meeting so that we all can reflect and come back and say, what are the other metrics that might make it better? So in the interest of action, we're going to run into strategies. And one thought I had is maybe I can just grab because I keep turning to look at the slides. If I can grab one of those, I can just speak off of this. So we're looking at strategies for key food and climate issues. And we've all introduced ourselves, but I'm Anu, this is Dana Boyer, and we're really grateful for both Tom Kotke and Mana Canterbury to join us and give us their insights on the health aspect and several programs that you'll hear about. So what we're going to do on the next slide is to really break ourselves down into 4 topics for discussion. The first topic is, what is our community-wide food demand? If you look at a year, how much food is being demanded by people, by households, by visitors, and by food processing industries. And that shapes all the food that's coming into the city. And so Dana's going to talk about that. She'll also talk about food and greenhouse gas emissions. We talked early on that one of the unique aspects of our food action plan is that we're going to link it with the climate action plan. And so this data would be really interesting to see how these two connect. So Dana will talk about that. Then I'll come back and talk a little bit about diets, equity, and food justice. That's the third topic. And then we'll talk about impacts on health. And between each of these, we're going to have Tamara and Nadia time us into some really interactive discussion. So as Tamara said, it's a new format, and we're going to try it out. So why don't I, without spending any more time, is everyone comfortable if I hand it off to Dana and she walks us through the first topic? We'll take a break. We'll do the second topic. We'll take a break. Okay, great, thanks.
So as Anu mentioned, the first topic is community-wide food demand. And so this answers the question of what is the demand of all food by homes, businesses, and industries. And so this is stressing that our food system is not just what the residents are eating, but we have food processors in the city. We have restaurants, we have visitors, we have commuters. And so what is the total amount of food that's coming in and out of the city? So with that lens, I'll orient you on this. The sort of yellow bubbles are proportionate to the end user of the food in the city. So what jumps out here is residents are responsible for about 76% of the food that's coming into the city. So how us as Minneapolis residents and citizens are eating are really shaping these flows. Then you have industrial food processors, which is relatively less, around 1%. And then non-residents, so visitors or daily commuters, then you're adding, that's making up that distance, so about 24%. And so taking all of the food that's coming in together, on the right, it's the distribution of total demand by food item by mass. So when you look at this, milk really stands out as being a pretty large mass. So again, this is mass, it's not necessarily calories or nutrition. You also have meat, fruit, vegetables, and grains are making up the predominant quantity that's coming in. And so some of the rest, like legumes, spices, oils, they're proportionally smaller. So they're all corresponding to different sections of that pie. So then when we start to think about the next week, we're going to start talking about production. And so just to give you a sense of what we're going to be looking at, we're going to be connecting the demand with production. So in Hennepin County, by mass, we can match about 10% of demand in terms of all the agriculture in Hennepin County. And then we're also going to be talking about different forms of growing, like backyard gardens and community gardens, on where is this demand actually being grown. And I want to stress too, this is the food that's embedded in all the food that we eat. So this is, when you have say the granola bars over that, that's made out of grain, there's sugar, there's etc. So this is broken down into the major food groups that comprises that, just to give you like an overview picture of it. So I think with that, you want to add anything?
I just want to highlight that. Similarly, milk, but it's not just the milk we're chugging, it's milk in yogurt, milk in ice cream, milk in pasta sauce. It's all of that. But we've broken it down to things we can rent. So we can then say, can we supply it locally if we want to?
Can you just go back to that slide and talk about your sources of information?
Yeah, of course. So in terms of residential diets, it comes from a CDC, National Health, it's called NHANES, I forget exactly what the acronyms are for. And so that gives an average residential diet across different socio-demographics. And then we got visitor data from Meet Minneapolis, which talks about the number of tourists coming in. There's also commuter data, the amount of people that are coming in daily. We have an economic input-output table, which shows the economic activity of the food processors within the county. And so we have all these sources compiled in a list currently, and we're going to be posting that on. So you can go into a lot more detail on that if you want to, if that's helpful. Yeah?
So do you have any sort of relative or level setting of how many tons per year does an average person use? Is this over-consuming the average for America or less than an average city in America?
Yeah, so unfortunately for diet data, we only have an American average diet. So we don't have any data in Minneapolis that says this is what a Minneapolis person eats, unfortunately. So this is the average. But we'll talk a little bit later about what is a sustainable diet and where does sort of the average American lie on that to start to get at this question, right? Because in some cases people are over-consuming, in some cases people don't have enough access, and so how do we address both populations effectively? So, any more questions?
Just a quick question. I'm assuming this also includes the food waste. It's basically just what's used. Right?
Yeah, so this is what the person eats, and then quantifying, okay, well, how much is actually need to be grown to support that, right? Because so much is wasted both before it gets to you, but also the amount you're buying, you're wasting some of that too. So it gets into that issue too. And food waste would be one of our topics. Yeah.
One other thing I wanted to say was that the same information we've done for Hennepin County, which has been through peer review. So we did Hennepin County, New York City, Pondicherry, and Delhi. So we did four cities? Yeah. 6. 4.
Well,
And that's going to be out, so the methods are available, it's peer reviewed, so you know that it's the same method that's on use. So.
Just greenhouse gas emissions. So if you recall 2 slides ago, we had a pie chart that shows what were the biggest foods coming in by mass. So these are those 5, so vegetable, fruit, meat, milk, and grain. And so immediately you see just the impact of meat. Okay, so this is the tons of carbon emissions per ton of food. So one caveat is there is slight variation depending on how the meat is produced, where it's produced, but not enough variation to really make much of a difference in comparison to the other food items. So this just frames this discussion as we start to think about strategies. It's hard to ignore meat. So, yeah.
Do you know why there's such a big difference between meat and milk, considering they're both cattle?
Yeah, because it's just the way it's allocated. So it takes a lot longer to grow a cow to be able to have it, right? Versus there's more production coming out of that one animal with milk. So it's like proportionate. Yeah, so it's like in the lifespan of the cow, there's just a lot more milk than there would be meat. So things would go. Yeah.
Isn't there a fairly significant differentiation between the type of meat, chicken?
Yeah, so there is. So this is just an average. So if it were beef would potentially, it would be even greater. Chicken is lesser. So this was just an average, just as an illustration, just to breach the topic of meat in general. But there is a pretty substantial difference between particularly dark meat and light meat because of the methane emissions that a cow would make. So this shows it by food item. And then when we start to compile all the emissions associated with all the food coming into the city, this puts it in the context of other sectors. So you see the food is in green. So this shows different sectors within Minneapolis. So you have on-road transport, you have electricity consumption, you have natural gas, solid waste, and wastewater. And so out of these sectors, food is about 17%. And this is the emissions that's embedded in the food of the production stage only. So this isn't quantifying the emissions that are associated with cooking your food or using your food. This is only the production. And so this amounts to 0.87 million metric tons of carbon emissions that comes out of production. So
Production, not distribution?
no, this is only the production stage, yeah.
Just to clarify, the reason for that is some of that distribution might be on-road transport, so you don't want to double count. Some of your cooking, all of your cooking will be in electricity and natural gas, so you don't want to double count. And so we've been careful to just say, here's production. In some inventories, people also do freight. So we've done that in other cities. We look at freight emissions separately, so then you can just isolate production because you don't want to be, double counting these emissions.
And when you think about the emissions at the different stages, by far, production has the largest emissions. So that's why, it's also important to focus on production as well. And we'll, throughout this process and the different topics, we'll be quantifying the emissions in the different stages of the food system. So we'll get to some of these later questions about what about transport or what about cooking, etc. So then the other question is, so what are some of these other environmental impacts? Because thinking back to our initial framework, we're not just looking at greenhouse gas emissions, but when we look at water and land, so we have greenhouse gas emissions on this side, and then we have water and we have land. And you see that for water, milk, meat, and grains, and fruit as well come up as pretty high water users. When you come to land, milk, more, meat more so than, but then there's milk and oil as well. And so this just again is showing how we can even look at environmental trade-offs. But in general, greenhouse gas emissions are more of the focus in this planning. To end with an example strategy to get people thinking about, okay, so here's our environmental impact. If our objective is to decrease the environmental impact in greenhouse gas emissions, what are some actions we might take? So this is an initiative that's gotten a lot of traction lately. So if we recall the high impact of meat, Meatless Mondays, I'm sure a lot of people in this room have heard about this campaign. So it's a campaign to avoid meat on Mondays, and the rationale behind Mondays is apparently people are more likely to adopt a healthy habit on Mondays. So if you quit smoking or if you an exercise regimen, Monday seems to be the day. So Monday, I guess, and there's alliteration with meat, I guess. But so the campaign's active in 29 countries, and over 100 US-based retailers, schools, places of work, and restaurants have signed up to this. So recently, the New York Public Schools, this past year, they piloted it in a few schools to do no meat being served on Monday, and it was really successful. So now they're rolling it out to all public schools in New York. So this is just an example of an action that a city is taking to address the environmental impact of their food system with potential health benefits as well. So with that, I think that was meant to give some more food for thought. Yeah, it's hard to avoid really terrible puns. And we can introduce the next discussion.
Can I just add one last thing? I think I saw this, there's about 5 cities, they now have a pledge to sign the Meatless Monday Pledge, which gives you a booklet with actions that a city can adopt. And I think 4 or 5 cities have adopted it. I think Pittsburgh, New York. I just saw that yesterday when I was reviewing this. So there's So how are people doing? At least for me, this was a lot of fun to do. And it was particularly fun because the group was foreshadowing some of the slides that are coming up next. And I was like, this is great discussion, because we're going to talk about it soon. So we're actually, believe it or not, it's 6:30 and we're on the 3rd topic. And the 3rd topic is a long one. Yes. All right. So we're going to talk about let's move this forward. Diets, equity, and food justice. And actually, many of you already raised this. You were saying, did you use the national average diet? And we did. We used national data to get the average food demand. But now we can dive into the national data and say, how do things look by income? How do things look by race? How do things look by gender? So that's what we've done. But before that, I wanted to talk a little bit about equity and food justice. And generally, at least when we study it in terms of income, energy, it has 2 components. One is deprivation or insecurity. Who doesn't have access to very basic nutritious food? And the second aspect of it is how unequal is the consumption? And how does overconsumption or high consumption affect everyone else? Does everyone see? So it's just like income. When you talk about equity in terms of income, you talk about poverty, difficulty in accessing livelihoods, and taking transport to go to your job. But you also talk about the other end. How much concentration of wealth is happening at higher levels, and does that have negative consequences? So if you can just think about equity in terms of both of those, you're looking at lack of access and deprivation, but you're also saying, does inequality matter when it has negative impacts? If inequality didn't have negative impacts, we wouldn't care. Does that make sense? And so we have just a little bit with that framing. And the first framing is just looking at who is the most vulnerable and who is hungry. And we pulled up the definition of what hunger means, so how it's defined in Minnesota. So in total, 9.5% of households in Minnesota are defined to be food insecure. And you can see it has 2 components. There's reports of reduced quality, variety, or desirability of diet. And that's about 5.2% of Minnesota population. And that's low food security according to the old definition. And then the very low food security was previously called food insecurity with hunger, where you have multiple indications of very disrupted eating. So it's the extreme case. And in total, we have about 9.5%. This is talking about hunger and healthy food access in Minneapolis. And so 32% of Minneapolis is designated as living in low access areas. And you can see in the map, in a meeting like this, we can't pour into the map, but you have a rough idea of where this is. And this is based on USDA designation of what low access areas are. And so they are both low in income and lacking a grocery store within half a mile is the definition this was based on. And we did some more reading in readiness for this presentation, and it's interesting where people are saying that just access will not ensure nutrition and good eating. And what you really want to be mindful is time. Do people have time to cook? What are they cooking? How can we get cooking in there? So other factors like time, income, even sociocultural attitudes towards food, how we think about different foods. And so just to make sure that we don't keep the conversation as extremely narrowly focused on food access, but we broaden it. So that was the purpose of this. And so I'm going to switch to the next topic, which is this idea of unequal burdens. And I'm actually going to switch to the next slide and then come back to this. And I'll explain that in just a little bit, because I didn't realize how small we probably should have this one. So let's talk about, because this came up in our table, did other tables talk about how is the diet different across different groups? Did that come up? Yes. And so let's just look at that, and then we'll go back to that complicated figure. And maybe I'll just tell you in words what that said. And so we looked at, so does everyone get this idea of unequal burdens from unequal consumption? So different people are consuming differently, and there's burdens. We talked about greenhouse gas, but one of the significant burdens is air pollution from growing food, particularly from fertilizer application. And those air pollution emissions are causing mortality. So overall in the US, there's about 100,000 premature deaths every year because of air pollution. And the premature mortality because of poor diets is almost double, just roughly, is about 200,000. So just to keep that in mind. Just diet-related mortality, premature, is about 200,000 people per year who are prematurely dying, as estimated by the Global Burden of Disease, and air pollution is about half. And about, I'm trying to remember the numbers, I think 40,000 of those premature deaths are because of agriculture. And so if you can make the connection, your diet shapes, if you can connect that to what people are growing, then you can say, is differences in diet causing negative impacts? So what we found by income is diet quality improves with income, as you would expect. And Dana is doing this from a large data set, so this is preliminary information, but her data is showing that the environmental impacts are also increasing by income. And I think this is not very surprising. Race actually had a relatively minor difference. It was less than 10%, and we're not sure how statistically significant that is. So there was a paper by Bozeman et al. That just came out, which looked at diets from the same enhanced data and looked at how different ethnicities, what are they consuming and how different it is. And he looked at land, water, and greenhouse gases and found the differences were not that high. This is on a per person basis. I just want to emphasize, on a per person basis. And then gender suggests that women have diets that are healthier and lower environmental impacts. I don't think anyone's surprised by that either. But this is everything on a per person basis, right? And so what I was showing on the previous slide was a very nice paper saying how does all of our consumption, not just food, but everything else, food, computers, electricity, how does all that affect air pollution? And how does our consumption affect the people who are being exposed to air pollution? And what we found was, because you're not going to be able to read that, and what we found was significant racial disparities. And this is across the whole population. So do you see that was per person, what I showed you previously, and this is if you just look at the whole US population. You can see, we all cause pollution, right? So you can see this is the cause and this is the exposure, just by the size of the bars, because I think everything else is too small for you to see. And food is the green thing here. Just green is the food. Remember, this is everything we're consuming. Then you can see among Hispanic, and then you can see how it's flipped across this. So this is simply to tell you what this idea of unequal burdens means. It's not to stimulate anything else, but just to say this is another aspect of equity. So we have deprivation, but we also have unequal burdens. And my guess is by income, this will be even more stark. They didn't do income in this paper. So we just wanted to put that out there. This is, again, these are publicly available literatures. And then the last slide, I'm laughing because we can say, well, there's differences, but then when you look at this slide shows, yes, there are differences, but on the whole, we're all eating poorly. And so, yes, there are differences, but on the whole, we're all eating poorly. 80% are under-consuming vegetables. 80% are under-consuming dairy, and we put a star there because this is based on the USDA's Healthy Diet Guidelines, which is actually having us eat too much milk, some people might argue. So we can have another discussion on that. Maybe our health folks can tell us more. 60% is under-consuming fruit. So while we could look at differences by income and so on, this is saying we're all really eating poorly. Which is not surprising, because that's why we have, non-communicable disease burden increasing. 60% are over-consuming sugar, and 80% are over-consuming sodium. So, again, I think that's the key takeaway. You can look at the graph later, but the idea is, yes, we could look at differences by race, by gender, by income, but also at the end of the day, we're just all really eating food. And so with that takeaway, we thought, let's look at some example strategies, and I want to invite Mana to talk about strategies to address this issue of diets, equity, and food access. And I also wanted to say that today's topic is really focused on diets. So I know that in discussion, food waste came up and local production came up, and I'm glad it did because those are the topics we're addressing. Food production is next September, and distribution, this question came up, distribution is next, and then food waste is after that. So it's actually, I found it really great to be in this group because you're foreshadowing, you're asking all the questions that we're also asking, and now we have a big resource of actions from this. So thank you for joining us.
Of course, thank you. I've got this, I've got one. Yeah, thank you. In 3 slides, I just want to cover a little bit about some other sources of information that we have and some other actions that are going on, mostly related to food insecurity. Some of it Minneapolis and Hennepin County specific, some of it a little bit broader. And this slide, and I'll have to describe the photo to you, but starting with, I work for a health system, as does Dr. Kotke, and there's been a big shift over the past 5 to 6 years in health systems recognizing the importance, nutrition's always been on the list, but food insecurity is growing on the list of understanding how that affects patients' or members' health as a healthcare system. And that's showing up really consistently in something that every hospital in the Twin Cities and across the country does, nonprofit hospitals, called a community health needs assessment. So I looked at and have been part of collaboratives around our Twin Cities hospitals, and literally all have said food insecurity is a problem. We have a role in supporting that or leading efforts or working with our patients. So there's some strong interest from the health community that may not have been there maybe 6 years ago or so. a way that the health systems, many health systems, are looking at that. One of the interventions that's really growing in strength is something called SNAP-RX, or screen, like in a doctor's office, screen for food insecurity, refer to resources in the community in a really specific way to address food insecurity right in a clinic. Again, probably not happening a number of years ago, growing in interest. But outside of the healthcare system, I just want to talk briefly about some of the work that Health Partners has been a partner in, called Super Shelf, because it works right within the food system that helps support people who are most food insecure. So just for language, a food shelf, that language is actually unique to Minnesota. Go Minnesota. They are called food pantries everywhere else in the country. But in Minnesota, a food shelf is a place that someone can go that have some income or other restrictions on it to get food either in an emergency or on an ongoing basis. These shelves receive food from lots of different sources. So I was super interested, Dana, in your sourcing slide about where does the food that gets not used or wasted or redirected go. It goes into this emergency food system that sort of works and is sort of not working great, okay? So food shelves are reliant on food banks who capture that up and help them. So we were looking and working with a food shelf, and this has turned into a big project called Super Shelf, where we could see an interest from the food shelf itself in wanting to offer healthier food to their clients. But Cub has a lot of blue cupcakes that they want to get rid of, to be honest. So instead of just looking at it as a single food issue, we looked at it as a whole systems issue. And so the methods we use, it's called behavioral economics. It means it's not about teaching people about food. It's not about teaching people how to cook. It's about changing the environment in that food shelf so that those who are most food insecure and most at risk come in and see fruits and vegetables first, less processed foods first, and then later in the shopping process, the more processed foods show up. So that first project has turned into a very large project, which I'll talk about in a sec. This is one picture from one of 16 food shelves that's been transformed or is being transformed through an NIH grant that was secured by the University of Minnesota to do Super Shelf. The before and after is a little hard to see, but it's the Aliveness Project in Minneapolis. And on the left side, a typical food shelf. Who's been in a food shelf? A lot of boxes, a lot of cans, a lot of shelves, right? And then when you go to the second slide, you can see fruits and vegetables are displayed first, so are canned and frozen fruits and vegetables, and then less processed foods, and then you have to go a long way until you hit the rice-a-roni. So it's a method that influences behavior. That work also includes a food shelf client survey. A couple people have said really eloquently who's not in the room. And a lot of the other work that looks at food insecurity either looks at systems, which is great, or talks to food shelf managers, which is great, but not clients themselves. So this is the Hennepin County data from a statewide survey of food shelf clients. The total survey had more than 4,200 responses in 199 food shelves throughout the state, an extensive survey with a very high response rate. In Hennepin County, this actually reached 19 food shelves with 442 responses. This is not an insignificant look at what's going on. While there was a lot of data, I was just thinking so much about the top foods clients want from a food shelf relative to the conversation at least our table was having around meat. Meat is consistently number one. The statewide data, it's number one in most of our metro counties, and it's number one in Hennepin County as a food that is most wanted by food shelf clients. And then it goes to fresh fruits and vegetables, dairy, eggs, and then cooking oils, supplies so you can cook your own food. We think, we don't know, but we think a lot of it logically has to do with cost. This also goes from the highest cost to the lowest cost items. But what it isn't is it's not ramen noodle and macaroni and cheese, even though that's often what gets donated to the food shelf system. So it argues with the point that ramen noodles should be the staple of a food shelf, and it says, look, make food groups to cook food at home. There's a couple other key points in here. 69% of survey respondents in both Hennepin County, and the statewide number is the same actually, reported having more than one chronic condition. And those we asked about were high blood pressure, weight loss, high cholesterol, or having diabetes by self-report. So it's also a population that is facing health issues and disparities in chronic disease. One of the big findings here, and it's kind of buried in the numbers, but there's 2 points. Clients at food shelves want the same foods that other people want. They also pretty clearly told us they're not very interested in being told how to cook those beans. Over and over again. Clients, you want me to someone to tell you how to cook beans? I'll tell you how to cook beans. It's all over the surveys. It's all over our client engagement strategies. This is using behavioral economics instead, treats the client with the ultimate respect and dignity to say, select your own food, first principle, and here's an array of healthy foods for you to choose for your family. So the work is growing. That's the list over there of the 16 NIH-funded sites. One is the Aliveness Project, and the other is CES in Minneapolis. Plus, they're all over the state, rural areas, suburban areas, all over. The NIH grant that I referred to is in the process of looking at 2 major things. First of all, client outcomes. In terms of diet, there'll be diet surveys, markers of cardiovascular health, food selection, and satisfaction with culturally specific foods. And then the food shelf, looking at what's available in the shelf. So the early results, there's a first article that just came out in January, starts to show that this really does have potential to help people have the healthy foods they want and to take them home. And then we'll see what this data says about whether that food translates into healthier diets for the clients that are served. This work is all a partnership that continues to grow, and the 4 main partners are listed on the bottom, but there's a big network now, including DHS, public health, and many other food agencies, Hunger Solutions, et cetera, that are expanding this work. So that is a good lay of the land of what we're doing in food insecurity. Yeah?
So if you're encouraging people to have the healthier foods, the less processed foods, the less sodium-filled foods, why is there an option to take ramen noodles and?
Great question. Yeah.
Why,
well, there's different philosophies on that. There's been food shelves, singular food shelves that have had, I'll call them no junk policies, that they refuse the Twinkies when the donor gives them, or the blue cupcakes. From a super shelf perspective, we have 4 guiding values that we use to guide our work. And one of the most important ones is being client-centered, and that includes giving the client the choice. That we did not want to fall into a paternalistic role to develop method that says you can't have that food. But instead, we use behavioral economics and food marketing strategies to respectfully make it easier for that person to choose. The data supports that when we change the environment, people choose better. And there might be a darn good reason why any one of us, or a food shelf client, might want the blue cupcake one day. And if they do it, that's still their choice. So, or ramen noodles. So we made that choice very intentionally to not fall into a paternalistic role between us and that person's food choices, which we consider an essential part of their dignity.
I do want to just throw one thing out there, though, just as a little bit of a alternative vision on it. You know, the foods that are processed and the foods that are marketed that are not healthy are very aggressively marketed and sway people's opinions about what is good eating.
Agreed.
So when you say, well, you're giving a free choice, is it really a free choice when you're inundated with the wrong choice of fast food and Cheetos and hot Cheetos and whatever?
It's not in the kind of the real world. These food shelves, by design, influence behavior in exactly the opposite direction. So what we do, when I said those foods were first, fruits and vegetables are first, plain grains are first, they have beautiful signs, they're in gorgeous baskets. By the time you hit the processed food aisle, either you might have used up all the food you can take, your cart is full, or you really don't care. And so we use reverse marketing without taking it away. There are no end caps with blue cupcakes, none. And it works. So the data shows we dropped syrup, how much syrup people take, by 85% by moving it. Yeah, it works. So we don't have to do the other things because we're reverse engineering the marketing.
Great.
Thank you, Martin, for that. Let's go through this. So now we're moving into the section on the impact of nutrition and diets on health. So looking at questions on what makes us healthy, and then how do we connect with what we eat with the health of people, but as well as the planet. So getting at this concept of a sustainable diet. So what is a sustainable diet? And here we just have the Food and Agriculture Organization of the UN states that a sustainable diets are those diets with low environmental impacts that contribute to food and nutrition security and to healthy life for present and future generations. Sustainable diets are protective and respectful of biodiversity and ecosystems, culturally acceptable, accessible, economically fair and affordable, nutritionally adequate, safe and healthy, while optimizing natural and human resources. So that's their official definition. But then I think, what does that actually mean? And so there's a lot of debate as to, okay, well, what is a diet that actually fits all those criteria? So diets that are promoted often as being sustainable are vegan, vegetarian. This is decreasing order again, and this is in terms of environmental impact, right? Not necessarily this broader view of sustainable, right? So vegan, vegetarian, replacing dark meat with light meat, pescatarian, so replacing meat with fish, and then also the Mediterranean diet. And this is just, again, to throw out what some people promote as sustainable diets, not to proclaim this is the diet that Minneapolis should adopt, but to open up this debate that's happening between a lot of people. So then to go on, so what is the impact of diets on, and nutrition on health? So Anu had mentioned just the amount of disease in the US that's attributed to a diet-related impact. So overall, dietary risks account for the most disease burden in the United States. So more than any other factor, so smoking, alcohol, pollution, etc., diet-related disease is highest. And so this is just a graphic. You can see the dietary risks are the highest in comparison to all these others. So alcohol use, drug use, etc. Diet-related disease is highest in terms of the burden of disease. So quickly going, what are dietary risks, right? So it's not just having a diet is a risk. So diets low in fruits, vegetables, legumes, whole grains, nuts and seeds, milk, fiber, calcium, seafood, omega-3 fatty acids, and polyunsaturated fats. So if your diet is low in any of these, that could cause you a health risk. Diets that are high in red meat, processed meat, sugar-sweetened beverages, trans fatty acid, or sodium are what are considered also having a dietary risk. And so this comes from the global burden of disease. So again, this just gives us categories that we should be shooting for when we're thinking about a healthy diet. And so this is just this schematic that shows going through that list, going down, and then these are all these diseases that are impacted by these categories going across. And so you notice diet low in fruits is impacting so many different things. So various cancers, heart disease, etc. And again, this isn't meant to be read in detail right here, right now, but it just gives you this idea of when you think about different aspects of your diet, so fruit, vegetables, sodium, it's linked to specific disease outcomes. So when we're starting to think about a healthy diet, what components of diet do we need to be thinking about? And so with that, I'll turn it over to Dr. Kotke, who works in this area specifically to talk about diet and health in Minneapolis.
Thanks, and these are just a couple of screenshots from the City Health Dashboard. On the left is life expectancy, dark is poor, light is good. And North Minneapolis, where life expectancy is 67.8. Down here in Minneapolis, it's about 25 years longer. Typically, what we see is about 10 years, but it also, that's not just diet. Then on the right side is obesity. Some of these, everybody's using the same data because there's only so much data out there. The presentations are just a little different. And then diabetes, again, you see this problem in North Minneapolis, in particular some in South Minneapolis, and high blood pressure, same thing, from diet, from obesity, etc. After about 45 years of markedly declining mortality from coronary heart disease, for about probably somewhere between a 70 and 75% decline in risk of coronary heart disease in the country, there's an uptick. So we're seeing, once again, an increase in coronary heart disease mortality from these kind of things. But I'd refer you to City Health Dashboard. It's really nice because it gives you the city, but the diseases, the rates fluctuate so much, we can't give rates by zip code, but we do know, I mean, life expectancy tells you disease rates, leading causes of death in the country are coronary heart disease and cancer, both of which are dietary diseases.
Okay, so just the last was just to get us thinking again on example interventions that could be affecting health. So one example would be a cooking class. So for instance, an example like Appetite for Change provides to, again, just talking about access isn't the only issue, but how do we decrease these other barriers or encourage healthier eating? Health Partners has a Power Up School Challenge, so classroom-based program focused on trying fruits and vegetables to get kids really interested in eating fresh fruits and vegetables. So in up to 62 area elementary schools, 5 in Minneapolis since 2012. And then another example, not from Minneapolis, but that's gotten a lot of traction in other cities, such as Philadelphia, is a sugar tax. So they implemented this with the tax on sugary beverages, and the revenue goes towards preschool education. So thinking also not only what are you taxing, but where is it going to? Can that address issues of equity? That's another way to draw that in. So, all right. With that, I think we're on to the discussion.
Yeah, we're back to our groups. I do want to make one quick comment. I think that this particular topic number 2, probably has the most focus on individual behavior, but systemic behavior and systems change is also a part of diets too. And so I just want to make sure people are thinking of both of those levels as we look at examples.